Hello everyone, this is Curtis and Kyle's Engi 450 homework, and we are going to be discussing cumulative trauma disorders. Cumulative trauma disorders in the workplace. They are also known as repetitive stress injuries, and typically they are injuries that irritate tendons, muscles, and joints over long periods of time. And also, they are usually injuries that occur from awkward or unnatural movements. We're going to be going through 5 cumulative trauma disorders: carpal tunnel syndrome, tennis elbow, trigger finger impingement syndrome, and bursitis. We're now going to discuss carpal tunnel syndrome. Carpal tunnel syndrome is a neuropathic condition that puts pressure on the median nerve within the carpal channel of one's wrist. And this injury is due to repetitive motions continually over long periods of time. And it causes the tendons that surround this median nerve to become irritated and inflamed and swell. And due to that, the median nerve becomes compressed, and then the median nerves becomes damaged. It only affects the wrist, thumb, index finger, and middle finger due to the median nerve. The median nerve only goes up those parts of your hand. So the main symptoms of carpal tunnel syndrome, you only have numbness. The only areas it affects is the thumb, index finger, and middle finger, and half of the ring finger, and you can have numbness and tingling in those areas. And also the shock sensation. This is very typical if you have carpal tunnel syndrome. Typically what happens is when the median nerve is damaged, if you have an impact on your hand, or say if you're catching a ball or with a baseball glove, or just catching anything or any impact whatsoever, you will have a shock sensation. It'll feel like tingling that's going through your fingers. You'll also have difficulty clenching your fist and grabbing onto objects. The primary causes are repetitive tasks, buffing, grinding, polishing, sanding, assembly work in the workplace. Again, anything that is repetitive over long periods of time, and movements that repeatedly involve the transverse carpal ligament and other supporting tendons. Some preventative approaches are to wear splints, practice special exercise to relieve pressure off the median nerve, avoid repetitive tasks, and take intermediate breaks in work. And some remedies: use cortisoid injections. You can do that, go to your doctor, and you also can get surgery. Tennis elbow, which is also known as lateral epicondylis, is swelling of and inflammation of tendons that connect the forearm muscles to the humerus bone. Injury is due to overuse and repetitive motions over long periods of time, and eventually small tears begin to form in the tendon, causing significant discomfort around the elbow area. The tendon that is predominantly affected is the extensor carpi radialis brevis. Some symptoms for tennis elbow: pain will slowly occur outside the elbow and gradually get worse from continued repetitive motions. One will feel burning in their elbow. That sensation, you get a weak grip strength. Also, primary causes are repetitive tasks, continual stress on forearm muscles, and any activity that causes the arm muscles to contract and the elbow to continually extend. And also, this can be due to improper form or biomechanics. Preventative approaches: basically someone should try to use any machines that can do the work for them instead of continually doing a repetitive task. that will wear out the muscles in their arms and tendons. Avoid motions and tasks that involve strong gripping and contracting the forearm. Wrap a plastic band around the forearm near the elbow to reduce pain. Some remedies: you can rest, throw some ice in your arm. You can take some ibuprofen, anti-inflammatory medicine. You go to physical therapy, and again use a brace. And you can also get surgery done on your arm.
Okay, so the next disorder we're going to get into is the trigger finger, which is a result of the swelling of the tendon in the finger. The tendon is unable to glide through the tendon sheath, which allows your finger to bend. It causes the finger to become locked in a bent position. Some of the symptoms for trigger finger are snapping sensation. It's just limited range of the extension of the finger, and pain, tenderness of the finger. Some of the causes can be excessive gripping of objects, continual stress on the tendon, and carrying heavy objects. Some ways to prevent the injury can be take breaks from tasks, avoid very strenuous gripping over long periods of time, and then avoiding strenuous light manual labor, utilizing machines of mechanical devices. And the treatments for this disorder is to reduce or use ice to reduce inflammation, taking anti-inflammatory pills, and exercise that will stretch the finger and the joints. Also splints, injections, and also in rare cases you can have surgery to treat the trigger finger. Another disorder in the working force is impingement syndrome. It's a rotator cuff injury which causes swelling and tears to the four tendons surrounding the rotator cuff. Swelling causes pressure on the tendons within the rotator cuff, causing loss of blood flow and discomfort. Some of the symptoms of this disorder are pain when lifting arms vertically, shoulder weakness, clicking noises when shoulder is rotated. The primary causes can be excessive force on the shoulder and repetitive overhead motions, such as lifting heavy materials or boxes above the head and putting a lot of stress on the shoulder itself. Some of the preventative approaches can be to avoid long, strenuous shoulder movements, taking breaks in between lifting things above your head. If you have a repetitive task of moving heavy objects from different shelves above your head, just to take some breaks in between, and also maybe use machines instead of manual labor when necessary. Some of the treatments are to rest, anti-swelling pills, topical pain ointments, strength exercises. Anything that help strengthen the tendons around the rotator cuff will help strengthen the rotator cuff itself from tearing, and also rare cases of surgery. The last disorder we're going to cover is bursitis. Bursitis is the swelling of the bursae, which are small sacs of synovial fluid that allow movement of tendons or muscles around bony areas such as your shoulders, your elbows, hips, knees, and even heels and ankles. The tendon will irritate the bursae from repetitive use, and which will cause the bursae to inflame. The symptoms of the bursitis is the joint itself will feel stiff when stationary and ache when not in movement. And then when you do move the joint will hurt even more than when stationary. The skin also around the joint will swell and look red and or bruised. Some of the causes are consistent repetitive motions and prolonged stationary positions. So when a worker is kneeling for a long time in a certain position, working on their knees, or even leaning and putting heavy weight on their elbows, this will cause the bursae sacs to swell, which will cause bursitis and cause joint injury. So some of the approaches to prevent this is to try to stay in one position for too long over a period of time, and avoid putting consistent pressure, especially on hard surfaces. So possibly kneeling or leaning on cushion areas or cushion surfaces to relieve some of the pressure off the joints will help prevent bursitis, and also taking breaks and using different motions when you can when moving. The remedies are to rest the joints, ice to reduce inflammation, bursae injections to reduce pain and swelling, and also physical therapy and muscle strengthening, and also surgery can be done to drain the swelling from the bursae. So in conclusion, these injuries and disorders are common in the workplace, but all of them should be taken very seriously. Most of them are treatable with minimum permanent damage if treated early on in the stages. And all of these can be prevented with proper knowledge of how they are caused. And not only should the employee be aware of these injuries and disorders, but also the employer should be well aware.